Getting our teeth cleaned is usually an enjoyable procedure for most of us, especially if our super gentle hygienist Mandy is cleaning the teeth, right? I'm sure you would agree. So what we are doing with the routine or the free or the prophylactic or prophy cleaning is that we are cleaning plaque, tartar, debris, food or cement from above the gum line. Now, if someone has periodontal or gum disease, that involves all of the tissues from under the gum line. Now, technically, we are in a very difficult area to clean, and a routine cleaning is not going to help control the disease. What needs to happen is that we have to schedule appropriate amount of time, and we use different techniques and instrumentations to clean out all of the diseased tissue from around the teeth so that it heals, and it also makes it possible for you to clean at home and maintain that tissue. And to maintain it further, we also recommend that you come in more frequently at the dental practice so we can keep the disease under control. You should know that untreated periodontal disease will have strong bacteria underneath the gums, and these bacteria release all these toxins inside the body. You are not going to feel it, but scientific studies clearly show the links between gum disease and Alzheimer's disease, stroke, diabetes, high blood pressure, and COVID-related complications. Please take this seriously, get your gums checked and measured, and stay healthy.